Hey everyone, Dr. Mike here. You know me as a doctor, but I'm also here as a friend. Someone who wants to help you understand the things that affect your life. Today we're tackling a topic that hits close to home for many: ADHD. We're going to break down the stigma surrounding ADHD and equip you with the knowledge to identify, understand, and manage this condition. Whether you suspect you or a loved one might have ADHD, or you're just curious to learn more, this video is for you. Welcome to our comprehensive guide on ADHD. So, let's start with the basics. What exactly are we talking about when we say ADHD? Well, ADHD stands for Attention Deficit / Hyperactivity Disorder. Now, I know that sounds like a mouthful, but bear with me. Basically, it's a neurodevelopmental disorder, meaning it affects the brain and how it develops. This can lead to a range of challenges, primarily with attention, hyperactivity, and impulsivity. But remember, everyone experiences these things to some degree. With ADHD, these challenges are more frequent and severe, impacting daily life in significant ways. Think about it like this. Imagine trying to focus on a conversation while 100 different thoughts race through your mind, or feeling like you constantly have ants in your pants, unable to sit still. That's the daily reality for many people with ADHD. Now, you might be wondering what causes ADHD. Well, that's where things get a bit complex. It's not a simple case of one single cause. Instead, research suggests that it's a combination of factors, like genetics playing a significant role. If a close family member has ADHD, the chances of you having it increase. But it's not just about genes. Environmental factors can also play a part. Think about things like premature birth, low birth weight, or even exposure to toxins like lead in early childhood. These can all influence the development of ADHD. However, it's important to remember that these are just potential risk factors. Having them doesn't automatically mean you'll develop ADHD. It just means there's an increased likelihood. Now, ADHD isn't a one-size-fits-all condition. It actually presents itself in different ways, which is why we talk about the types of ADHD. The most common types are predominantly inattentive, predominantly hyperactive impulsive, and combined type. Let's break those down a bit. People with the inattentive type often struggle with, you guessed it, attention. They might have difficulty staying focused, get easily distracted, or struggle to follow through on tasks. Then there's the hyperactive impulsive type, where individuals may seem like they're constantly on the go, always moving, talking excessively, or interrupting others. They might also struggle with impulsivity, acting without thinking things through. Finally, the combined type, as the name suggests, is a mix of both worlds. Individuals with this type experience a combination of inattentive and hyperactive impulsive symptoms. Now let's dive deeper into the symptoms of ADHD. Remember, these symptoms can look different in children and adults. Children with ADHD might have trouble paying attention in class, struggle to follow instructions, or be easily distracted by their surroundings. They might fidget, squirm, or have a hard time sitting still. Adults with ADHD, on the other hand, might find it challenging to manage their time, struggle with organization, or have difficulty completing tasks. They might also be restless, impatient, or prone to making impulsive decisions. It's important to remember that everyone experiences these symptoms occasionally. However, for someone with ADHD, these symptoms are persistent, pervasive, and interfere with their daily life. Diagnosing ADHD isn't as simple as taking a blood test. It involves a comprehensive evaluation by a qualified healthcare professional, like a psychiatrist or psychologist. They'll take into account your medical history, conduct a physical exam, and gather information from you, your family, and teachers if you're a student. They'll also use specific criteria from the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, to make a diagnosis. This might involve filling out questionnaires, keeping a symptom diary, or undergoing neuropsychological testing to assess things like attention, memory, and executive function. Remember, getting a diagnosis is crucial for understanding your symptoms and accessing the right support and treatment. The good news is that ADHD is treatable, and there are several effective options available. The most common treatment approach involves a combination of medication and therapy. Medications like stimulants can help improve attention, focus, and impulse control. Therapy, such as cognitive behavioral therapy, or CBT, can equip individuals with coping mechanisms, organizational skills, and strategies to manage their symptoms effectively. Lifestyle changes can also play a significant role in managing ADHD. This might involve things like creating a structured routine, getting regular exercise, eating a balanced diet, and ensuring adequate sleep. So there you have it, a comprehensive look at ADHD. Remember, knowledge is power. The more we understand about this condition, the better equipped we are to support those who live with it. If you suspect you or someone you know might have ADHD, please reach out to a healthcare professional for a proper diagnosis and to discuss treatment options. Living with ADHD can be challenging, but with the right support, individuals with ADHD can thrive and lead fulfilling lives. Don't be afraid to seek help, and remember, you're not alone on this journey. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more informative content.